So my name is Eric Mate, and I work with the Medication Therapy Management Group here at Mayo Clinic. On a day-to-day basis, I see patients referred either through GIM physicians who come in on multiple medications, and I help them review, identify any drug-related issues, and at the end of the day, provide recommendations that go back to either their primary care doctors or the doctors that refer them to the service. Some patients might not relate their side effects that they might be experiencing to their medications, and this is where pharmacists can come in through the review of their medications to bring up the fact that maybe the side effect that the patient is experiencing could be from the medication that they are taking, and in that instance a pharmacist can come in and help. Some patients might not be taking their medications because of side effects that they are experiencing. Some side effects are most severe when a patient starts the medications but do subside. And so if a patient is aware that the side effect that they are experiencing could subside over a period of time, they might more inclined to finish or continue with therapy. And this is where a pharmacist can come in to help with compliance. When we look at pharmacists are the drug experts, and sometimes, or in most instances, patients are seeing various physicians who in some instances might not know what one provider has prescribed. And so coming in to see a pharmacist helps tie in what other providers have provided to or prescribed to their patients, and help ensure that if there are any drug interactions, we identify that, and that information can be sent back to the primary care provider, who can then say, oh, I wasn't even aware that you were taking these medications. So when we look at the healthcare loop, the pharmacist is that safeguard when it comes to the medication experience. The pharmacists who are in the MTM program here at Mayo Clinic do work with other healthcare teams. See, all of our pharmacists in the MTM group work hand in hand with our physicians here. So when a patient comes through the MTM program, we normally recommend that they bring all their medications to the consult. Once the patient comes in, pharmacists will review all their medications once again to ensure that patients understand why they're taking the medication. So the first thing that the pharmacist will do is to review all the medications for indication. They will also review to ensure that the patient has the best drug experience. So we're looking for efficacy to ensure that the patient is benefiting from the medication. We'll also review to ensure that if there are any adverse drug reactions that the patient might be experiencing, we catch that, address that with the patient, and maybe provide alternatives for the patient. Lastly, we ensure that patients are taking their medications as directed by their physicians. So at the end of the day, when patients leave an MTM consult, there is a medication action plan that the patient will take home with them. We also follow up with an after-visit letter that the patient can then take to their primary care doctor to further discuss the recommendations made by the pharmacist.